Our question today says, the nurse is caring for a client who is receiving IV vancomycin through a peripheral venous access device, or VAD, VAD. Which of the following actions should the nurse take? Select all that apply. So we're going to have multiple correct options here. Let's look at them. Option 1 says instruct the client to report any hearing changes. This is going to be a correct option. So vancomycin or vanc can be ototoxic and cause damage to the ears. We definitely want to note those changes in hearings. We may need to reduce the dose or discontinue it altogether. Option 2 says to monitor the VAD insertion site frequently for erythema and swelling. This is going to be another correct option. Vanc can cause phlebitis, can cause tissue necrosis. We want to monitor for any abnormal findings at our AV sites. Option 3 says to use an infusion pump to administer the medication over 20 minutes. This is going to be an incorrect option. Vanc can cause tachycardia, hypotension, a rash. We definitely want to infuse it usually over greater than an hour. Option 4 says check the client's serum creatinine level prior to administering the medication. This is going to be a correct option. Vanc is nephrotoxic, so if we have renal impairment or an elevated creatinine, we will need a renal adjusted dose or potentially a different antibiotic altogether. And then option 5 says to obtain a serum trough level after administering a scheduled dose of the medication. This is going to be an incorrect option. So because vanc is nephrotoxic, ototoxic, those kind of things, we want to make sure our clients aren't getting too much. We want to draw a trough once they're on vanc therapy, usually before the third dose. This is going to tell us how much medication is in their system and if we need more or less for our future dose. So our correct options today are 1, 2, and 4. The nurse has taught the spouse of a client with hepatic encephalopathy who is receiving lactulose. Which of the following statements by the client's spouse would indicate a correct understanding of the teaching? So first, we need to talk about hepatic encephalopathy a little bit. It results from liver disease or cirrhosis where the liver can't filter out toxins. So we get a buildup of ammonia in our system. It causes acute mental status changes, confusion, agitation, asteriscus, those kind of things. So let's look at our options. Option 1 says the medication may cause constipation. This is going to be an incorrect option. Lactulose is a laxative. It's going to cause diarrhea in these clients. Option 2 says the medication is administered as an injection. This is going to be an incorrect option as well. Lactulose works directly in the colon to excrete ammonia, so it's usually given orally or rectally, but never intravenously. Option 3 says the medication will improve my spouse's confusion. This is going to be our correct option. So because lactulose helps excrete ammonia, that's going to improve our confusion. We're going to have more clear thinking, those kind of things. And we often want to adjust the dose based on our client's mental status. And then option 4 says the medication will decrease my spouse's liver enzyme levels. This is an incorrect option. It's not going to touch the liver enzyme levels. We really give it for the complication of the liver condition. It doesn't actually treat the liver condition itself. So our correct option for today is option 3. The nurse is caring for a client with a new mechanical heart valve. The nurse should expect that the client would be prescribed what? So let's look at our options. Option 1 is warfarin, and this is going to be our correct option. So we know warfarin is a vitamin K antagonist. It's going to reduce the risk of clot formation on that mechanical heart valve. We definitely want to teach those clients to get frequent lab checks, to monitor their INR, and we definitely want to keep it in that therapeutic range. Option 2 is dabigatran. This is a thrombin inhibitor. It's an incorrect option. It's actually contraindicated for clients with mechanical heart valves. Usually we give it for a DVT, a pulmonary embolism, or stroke for clients that have atrial fibrillation. Option 3 is tacrolimus. This is an immunosuppressant or anti-rejection medication given for clients with a transplanted organ, not needed for a mechanical heart valve. And then option 4 is apixaban. This is a factor 10A inhibitor, similar to dabigatran in that it is not indicated for mechanical heart valve. It's just not the best choice for these clients. We want to get these clients on warfarin. Option 1. The nurse is caring for a client who is receiving sertraline. It would require follow-up if the client reports what? So here we're looking for a problematic finding, okay? Option 1 says drowsiness and fatigue. This is going to be an incorrect option. It can happen when we start an SSRI like sertraline, but that'll improve the longer we take the medication. At first, though, we do want to avoid driving, maybe other CNS depressants like alcohol, those kind of things that can worsen that drowsiness. Option 2 says diaphoresis and fever. This is going to be our correct option. It requires follow-up because these are findings of serotonin syndrome. Basically, what happens is we have excess serotonin floating around in the brain when we're taking sertraline. That helps increase our mood, but it increases that circulating serotonin, increases those symptoms like diaphoresis, fever, agitation, tachycardia. We want to discontinue that medication, give supportive care. This is an emergency for that client. Option 3 is a decreased libido. This is going to be an incorrect option. It is a known expected kind of side effect, but it does really increase the risk for noncompliance. So we definitely want to open that discussion, but it doesn't necessarily require follow-up. And then option 4 is weight gain. This is going to be an incorrect option as well. Clients can experience weight gain or weight loss with SSRIs, another big reason for noncompliance, but it's not life-threatening. So our correct option for today is option 2. The nurse has had a client with hypertension who has a new prescription for ramipril. Which of the following statements by the client would require follow-up? So let's look at our options here. Option 1 says I should discontinue the medication if I develop swelling of my lips or eyes. This is going to be an incorrect option because it doesn't require follow-up. This is true. We want them to discontinue this medication if they develop that swelling. That's angioedema. It can compromise the airway. We definitely want to stop the medication and notify the healthcare provider. Option 2 says, I will avoid taking a potassium supplement with the medication. This is going to be an incorrect option as well because it is a true statement. It doesn't require follow-up. We want to avoid potassium supplements or potassium-sparing diuretics. It increases the risk for hyperkalemia and cardiac dysrhythmias with ACE inhibitors. Option 3 says I can continue taking the medication if I become pregnant. This is going to be our correct option because it requires follow-up, okay? So ramipril, ACE inhibitors can cause renal dysfunction to the fetus in utero. It can pass through breast milk as well. So we will need some other medication to control our hypertension if we become pregnant. And then option 4 says I may develop a dry cough while taking the medication. This doesn't require follow-up. It is a true statement. It's kind of annoying for these clients, but it's not harmful. Sometimes we can switch to like a beta blocker or something else if it becomes a problem, but it doesn't really require follow-up. So our correct option for today is option 3.